Good evening. I'm Chris Thomas. Thanks for joining us. As California continues to break new records with the coronavirus, the governor making a big announcement today. Take a look. The state is reporting more than 18,000 new cases. That is over 2,000 more cases from the day before. Sadly, deaths are also up. 113 more people died from the virus in the past 24 hours. But the big reason the governor is announcing new regional stay-at-home orders is because of the number of people in the hospital. That number is up more than 3% over yesterday. And numbers of ICU patients is also still increasing. We have live team coverage tonight. Lena Howland is in San Joaquin County looking at the impact on local hospitals. Monica Coleman is in Roseville with how people are reacting to the new restrictions. But we start tonight with Mike Duffy, who's breaking down what this stay-at-home order means, Mike.
Chris, Governor Newsom and Dr. Galley announced that those shutdown orders were happening, but they said that they're different than they were back in March. And they say that the stakes couldn't be higher right now.
The bottom line is if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb, more lives lost.
So the state will transition to staying home region by region.
We have 5 regions in this state. These regions are considered and constructed based upon pre-existing mutual aid system in the state of California.
And this is the criteria.
Regions where the ICU capacity is falling below 15%. We are now mandating a stay-at-home order for 3 weeks.
Newsom says they expect 4 out of the 5 regions, including the greater Sacramento region, to be under the stay-at-home order within a week, and all of the state by the end of the month. And Dr. Galley explained the message is a radical shift.
Today's message is not about how do we mix safely, it's about how we reduce our mixing altogether.
This means some businesses allowed even in restrictive tiers must shut down again.
Bars, wineries, personal services, hair salons, and the like will be temporarily closed for that 3-week period.
And he also says the vaccine will arrive soon.
We have 327,000 doses of the vaccine that we anticipate receiving anywhere between December 12th and December 15th. Help is on the way. There is light at the end of this tunnel. We are not in a permanent state. This is a temporary state. This is the 3rd wave of a pandemic.
Now, like the governor mentioned today, hospitalizations and ICU beds are in short supply in many parts of the state. In this area, San Joaquin County is having a hard time. I want to show you this graph. It shows the steady spike in hospitalizations since October. The county now reporting 162 people in the hospital because of COVID-19. The number of people in the ICU also up to 41 patients. ABC 10's Lena Howland joins us now live from San Joaquin County with details on how hospitals there are preparing for this continued surge in patients, Lena.
Well, we're at the San Joaquin General Hospital, one of the largest hospitals in this county. We're right now inside of these doors. Their ICU is operating at more than 180% capacity. What that means is that this hospital is in a critical state. Health officials tell me that they have been inundated with patients. They are busy working around the clock, moving people around to make room for everyone in need.
These hospitals are having to make ICU space in space that was not created for that.
As the number of people with coronavirus coming through hospital doors have doubled in only a matter of 2 weeks, the San Joaquin County Emergency Medical Services Agency says county hospitals are now operating at surge capacity.
It's a time that they're already busy anyways in any normal time because of the flu season and of other their normal patient load.
Yamilet Valladolid knows the strain the pandemic has placed on Spanish-speaking families across the Central Valley. So she created a Facebook page specifically for critical coronavirus information like this, but in Spanish.
This is when we need to do a call out truly. If we care about our community, let's put our mask on, let's stay 6 feet away. Let's connect virtually and make a difference.
As hospitals are inundated, she is urging her community specifically to stop all social gatherings.
We need to be conscientious that our health professionals are on the verge.
Back in July, when San Joaquin County hospitals reached this level for the first time, they had 2 federal medical teams to help with 2 hospitals overflowing. But this time they say it's not guaranteed. So they're hoping the news of our second statewide stay-at-home order will once again help slow the spread. Now, health officials added that despite these ICU capacity numbers, their 911 system is still in place right now, and people should not be afraid to come to the hospitals to seek out that care that they need. Back to you.
Arlena Howland reporting live tonight from San Joaquin County. Sacramento area businesses are reacting to the new shutdown order tonight, with barbershops and bars preparing for yet another shutdown. A bar and barbershop owner we spoke to says this is all very disappointing.
Obviously, it's pretty crushing. We've had a hard-fought battle this year for both sides of the business, the bar and the barbershop. I think it's most frustrating that people are still trying to blame the government. Government's just doing government things. The real issue is large gatherings, and people don't seem to want to stop doing that, but then turn around and say how bad they feel for us, which is a little bit frustrating because, actions speak louder than words.
Anthony says moving forward, he plans on shutting down all seating and continue to do to-go orders through the Bottle and Barlow website. Many businesses are not happy with the announcement that a new stay-at-home order may be coming for Placer and Sacramento counties, and some say they plan to defy the order and continue with business as usual. ABC 10's Monica Coleman is live in downtown Roseville with that part of our story. Monica.
Yeah, Chris, here in Placer County, they are in the purple tier, so downtown Roseville restaurants can't allow people to enjoy a meal outside or grab a cup of coffee. But that may change as cases continue to rise. Businesses in Placer County are preparing for another potential stay-at-home order, forcing them to close down once again. Mugshot Barbershop is located in Roseville, and manager Sarah Pryor says they are still trying to recover from the first stay-at-home order in March.
It's made it very unstable, so there'll be some weeks we're really busy, we're making plenty of money, and then there's other weeks where almost nobody comes in.
Many businesses are deciding to defy the state's public health order, and Sarah says she stands with them in their decision, but doesn't know if she would be able to take the financial hit of not complying.
As much as I want to defy it, it wouldn't make any financial sense, and it would damage us. I would stand by all of these other salon owners that are staying open. It's just that I think staying open, if we got caught, would tank us.
Karen Bowman works at Bar 101 in downtown Roseville and says they will comply, and businesses that decide not to are putting others at risk.
That's the order. And then also it's not like some mean guy imposed it on us. It's like, it has to do with the public safety.
Placer County Public Health says COVID-19 cases are the highest they have been since the summer, and that there is enough ICU beds currently, but that could change in the coming weeks.
If the cases continue to grow and we see more and more people needing ICU beds, I believe the administration is estimating we're days to weeks away from seeing our ICU bed capacity overwhelmed.
The Placer County Sheriff's Office and Placer County Public Health say that when it comes to enforcing the possible stay-at-home order, they will lead by education. Chris.
Monica Coleman reporting live for us tonight in Roseville. Monica, we thank you. We know there was a lot of information today from the governor about the stay-at-home order, and we have a team standing by to answer your questions. Just text the word HOME to 916-321-3310, and we'll send you information on what will stay open and what will close, as well as resources for financial support.